Hello and welcome to another episode of Earth911, Sustainability in Your Ear. I'm Mitch Ratcliffe, your host. You know, pharmaceutical pollution is a growing problem all over the world. The U.S. Geological Survey in 1999 and 2000 surveyed 139 streams in 30 different states and found that 80% of them contained medication in the water. That includes antibiotics, antidepressants, blood thinners, painkillers, and all of this can build up in our bodies. It can build up in the bodies of the food animals that we eat. For instance, recently, salmon near Seattle were found to be full of antidepressants. Happy fish, but not necessarily fish you would want to eat. And what we need to do is find ways to safely dispose of our pharmaceuticals rather than flush them down the toilet or dump them in the trash. And so we invited Nancy Devine, who's the Chief Operating Officer for Deterra, which is a division of Verde Environmental Technologies, and a maker of a drug disposal system, the Deterra Drug Deactivation System. Nancy, how are you today?
I'm good, thanks.
Well, hey, thank you for joining us on the show. You know, as I mentioned, pharmaceutical pollution is a growing problem all over the world. Can you kind of lay out for us how big a problem we're facing as we add more advanced medicines to our lives and need to dispose of them?
Yeah, I can. First, thanks for having me today. I appreciate that. The pharmaceutical waste problem, it's a big problem, but it's both a public health and safety problem and an environmental issue. Mm-hmm. So I kind of wanted to frame up the public health and safety issue first and then go into the environmental issue.
Sure.
The opioid epidemic, it's a public health emergency. So we know that now with COVID, up to 200 Americans are dying every day of opioid overdoses. You know, part of the problem is that 90% of patients with these prescribed opioids, they actually have pills left over. They're not wanting to take all of their medication because, on the positive side, we've been educating people about the dangers of these drugs and they're more educated. 2/3 of these people are keeping them, and they're keeping them because they don't really know how to properly dispose of them, or they don't have the means to do so. You know, 1 in 5 people, they share their medication with another person. So if you kind of couple that whole problem with the fact that these medications are continuing to be prescribed, there's enough of prescriptions of opioids being written each year for half of all Americans to actually have one, which is a lot. And it's a lot of dangerous medicine in our homes. And those are available for people to misuse, to, have an accidental poisoning,
Sure.
To abuse, to divert. And, and when you think about the opioid overdose problem, you think, well, why is my prescription medication, why is that important? Because, and it's really important because, about 75% of people that are addicted to heroin or other illegal drugs, they really started their addiction journey, which is like their first use with that prescription painkiller that's really right now all too easy to access. So, prompt disposal of these medications is super important. And, we know by disposing of these and having them not available for use, we can prevent addiction and we can prevent overdose. And eventually we can prevent deaths from occurring. So,
and that's so important because, it's the fact that these drugs are lying around. A child could get hold of something like this.
Absolutely.
And I happen to, unfortunately, be caring for my brother who has cancer. And we have medication that if it chips, we have to essentially declare a hazardous waste emergency.
Yeah.
And isolate the material so that it can be disposed of safely. Mm-hmm. This is it's everywhere in our homes today. So how do we start to manage this, and what should we do with the drugs when we decide we don't want them anymore?
Well, yeah. So, when you're talking about the environmental piece, you mentioned, and it's true, pharmaceuticals are showing up everywhere. And you mentioned a few of those. They're really ubiquitous in our environment, and the scope and magnitude, I think we're just we're just starting to understand, and we don't really know ultimately the toxicity to animals and humans, but we are starting to address it. Deterra, we have a product that is available. It's super simple to use. It permanently deactivates these medications, so it makes it safe to dispose of them at home right away and throw them in the household trash. So that's just, one thing that people can do to reduce the amount of medications and to dispose of them properly.
Well, let's talk a little more about how the Deterra Drug Deactivation System works, because it is surprisingly simple. You offer a pouch. That pouch has activated charcoal in it, and I believe other things. How does this actually work? What happens how do I take my drugs and process them using the system?
Yeah, you're right. It's super simple. And actually, there is nothing else really in the pouch. It is a proprietary form of activated carbon that we've tested extensively. It's super effective at adsorption. So you just open the pouch, you add in your medications. Mm-hmm. It needs a little bit of regular tap water, and that dissolves the little pod that's inside. You want to keep that carbon pod inside mm-hmm. of that pouch. That sort of, it looks, similar to like a laundry pouch.
Right.
That really opens the carbon pores, and that makes them available for the process of adsorption.
And so then it's a resealable top, and you just...
Yep, so then you just close the pouch. It's a zipper seal, and you shake it for a couple of seconds, and it's safe to dispose of in the household trash then.
Okay, so very simple. Now, so it takes a few minutes, and when I put it in the trash, are the drug molecules permanently bonded to the carbon in a way that they can't create pollution if they broke down in the landfill?
Yeah, so it's really a well-known process, and as you probably and your listeners know, that activated carbon's used for cleaning up lots of different contaminants at Superfund sites and everything, and that's because that activated carbon is very, very effective at permanently binding all those drug molecules, and so it won't make those available for use. You can't back extract it. You can't really break that bond. Mm-hmm. And that's what really makes the medications unavailable and non-retrievable.
Now, are there drugs that you can't use the pouch with?
There are some. What I would say is our pouches are for any over-the-counter and prescription medications that include organic compounds, so it's the vast majority. Okay. And in our homes, the only real thing that I can think of would be a daily vitamin that might contain a metal like zinc or like iron that is inorganic. And of course, you mentioned some chemotherapy drugs. Those are specifically handled in a very, very, very different manner. So you wouldn't want to use those.
So let's step back for a moment and talk about, you just mentioned several different categories of drugs, and daily vitamins is not something that I would think of as being a potential source of pollution, at least, outwardly. Is that something that you should also avoid flushing or throwing into the trash without processing?
I think some of the common daily vitamins are probably not all that dangerous for the environment, although our labs haven't done a lot of studies on that. Mm-hmm. There really aren't any common household over-the-counter or prescription medications that you can't deactivate, and it certainly wouldn't hurt to do so. So we think about the different form factors available, and Deterra works on pills, it'll work on liquids, cough syrups, it will work on any kind of gel or cream or film, even like fentanyl patches, which is how it was sort of originally developed.
Huh. Now, what about ibuprofen and simple painkillers? Are those things that should be processed as well?
Yeah, and it works on all of those things.
Okay, now, and how much can you put into a pouch? Could I take an entire jar a pill bottle and dump it in, assuming that I wasn't going to use it, or is it something where I need to put in only 5 tablets per pouch?
Yeah, you'll want to definitely follow the label instructions. We, the ratio of carbon that deactivates effectively, we've studied, and we really hold ourselves accountable to making sure that our product will destroy completely what we say it does. And so we have pouches that are in small, medium, large, and extra large, and those can be used in home settings. And so you just want to look at the label instructions. Our small pouches are typically used for what we call co-dispensing. So if you have a post-surgical pain prescription that might have, less than 20 pills in there, you'll want to use that because it will deactivate up to 15 pills. The medium pouch is up to 45, our large pouch is 90, and the extra large is up to 450. And so you just want to be following the label instructions when you're doing that.
Now, the pouches, once they're in the trash, I know that they're made of at least 50% recycled material. Do they themselves biodegrade in the landfill, or is the fact that they don't biodegrade part of the system that protects us from the drug molecules it contains?
Yeah, that's a great question. And just I'm probably going to give you a longer answer than is maybe necessary.
I think our listeners want to hear the details. Go for it.
Yeah. So, and I've listened to some of your podcasts, and I know your listeners know waste disposal and recycling. They're really complicated issues. And, it's sometimes difficult, I think, for a manufacturer to really know, okay, what has the least environmental impact? And when you're thinking about this product, like you mentioned, it's not, we're not the typical single-use disposable product. So you're not really consuming what's in the bag and then disposing of the bag. You're adding waste to the bag. So recycling definitely wasn't feasible in that way. But we thought our best effort in sustainability would be a couple of things. First, to use as little plastic as possible in the pouch itself that would still meet our quality guidelines and ensure that the zipper seal is intact and the integrity there is perfect. So we didn't over-engineer the plastic. We want to use as little as possible. And then the plastic that we use is actually 50% or more bio-based. So the plastic resin we get comes from sugarcane. So that allows us to reduce our overall greenhouse gas emissions.
Right.
And we're limiting our impact on global warming. And our vendors that we use have, gone to the lengths at doing all of the product life cycle calculations for us so that we have that data available to us. But on the actual manufacturing side, not just the resin creation, we wanted to really carefully choose our pouch manufacturer. So the plant that we work with is a LEED Silver certified plant, which is really difficult to get that certification as a plastics manufacturer. They're using a lot of advanced technologies. So not just to reduce like the ink consumption and the solvents and the hazardous waste, but their plant is powered on 100% wind generated energy.
Oh, great.
And yeah, so what we've chosen to do is to use a renewable resource to create that resin, and then, ultimately a renewable resource to manufacture it into the pouch. And so the bio-based polyethylene that we use isn't biodegradable, but we're investigating other markets of bioplastics that might actually be biodegradable and available to use in our products. But right now, we just feel like the front end of kind of that sustainability cycle was a better fit for us.
Well, and sustainability is still a trade-off. We haven't achieved decarbonization. So Right. It does make sense to prioritize safety when you can't make guarantees about sustainability, ultimate biodegradability of something at this time. So that makes sense. Now, you've just completed a project to distribute enough Deterra Drug Deactivation disposal pouches to eliminate more than 1 million prescription pills. How'd that program go?
That program went and is going great. We teamed up with a nonprofit called Safe Project, and their goal is just to end this addiction epidemic. And we created with them a program called Gone for Good, and it's really for any consumer in the U.S. to receive a free pouch. So we started this in April. We kind of mirrored it with Drug Take-Back Days. We're very, very much a partner with the DEA on trying to create all sorts of safe disposal routes. And so we mirrored this with April and October. And consumers could just go to our website, which is deterrasystem.com/safe, and request a free pouch. And then we mailed those pouches to their homes. So, in other months where it's not available, like right now, anyone can still go to the website. They can get on the notification list for the campaign. The first campaign in April, we deactivated, I think it was nearly 1 million pills, which was actually double our goal. And right now we're on track that we'll be distributing these pouches in November, that it'll be about 1.5 million pills. So we've been really happy with this. We want anyone who needs a pouch to get one. And we're going to continue this campaign through next year as well.
Okay, so people should stop in at deterrasystem.com/safe and sign up for notifications so they can get into the next program.
Absolutely.
Okay, great, cool. Now, you mentioned the DEA, and are they helping to subsidize the distribution of these things? Is this something that the government is getting involved in order to create greater safety around drugs?
We work with a lot of government entities that use grant money to purchase our product and distribute. The DEA funds Drug Take-Back Days, and some of the police departments locally, many county police departments have utilized those funds for our pouches. So not only have they been able to collect unused medications from residents, they also are moving, especially with the current pandemic, to sort of drive-through was probably a better word for that, events where they'll hand out a Deterra pouch to residents, and they can go ahead and just take that home and use it at home rather than bringing their medications to the police station. So we partner with the DEA on that, and the federal government has issued, millions and millions and millions of dollars for their opioid response programs. And those are used largely for treatment and sort of downstream effects.
Right.
But they also do designate a lot of that funding to preventative, like education and safe disposal. So we are seeing some really good traction from the federal and state governments.
Now, if a patient has a financial need, they simply can't afford, I know you give a few pouches away individually, but if somebody needs a supply of pouches, is there a financial assistance program available for them?
There isn't a specific one that I'm aware of, but by and large, all of the pouches that are distributed are free to the consumer. So It's a matter of finding a community event or a hospital system that hands them out, or even what we're finding is employer health plans are starting to partner with their pharmaceutical benefit managers to send these to people when they have a prescription.
So it's probably a good idea to ask your insurer first if that's something that you can get. But does Deterra offer a search for that kind of service at all, or is there any online resource that somebody could tap into?
Yeah, they can go to our website, and there's a form they can fill out that asks for their state, and one of our employees and our sales team members can give them a call back and get them in touch with local agencies that have our pouches available.
Well, Nancy, this is great. Thanks very much for taking time to talk to us about the Deterra Drug Deactivation System.
Oh, you're welcome. Anytime.
Well, folks, that was Nancy Devine. She's Chief Operating Officer at Deterra, and Deterra is based in Minneapolis, if you're interested in the geographics. Check out Deterra System. That's system, not systems.com. And you can learn more about the drug deactivation system and the various pouch distribution programs. This is Earth 911 Sustainability in Your Ear. I'm Mitch Ratcliffe, and we're going to be back with another innovator interview soon. In the meantime, take care of the planet, take care of yourselves, and take care of one another. Have a great day.